In this video, I'm going to demonstrate the partogram. This is a new labor graph component that you can use for following your labor patients. You'll find it in the acute workflow. This will be in a different place depending on your position, but you can go ahead and click on the acute workflow. The first time you bring it up, it will probably be under this little drop-down arrow. And so here you can see the partogram. So I'm going to go ahead and bring up the partogram. Sometimes when you bring it up, it will say this, and in order to launch the partogram, you do have to document labor onset date and time. This can be documented by nurses or physicians. And go ahead and pick a time that you would like for launching the partogram. And so I'm going to go ahead and add a labor onset date and time for this patient. You'll find that here under labor, and then here under cervical exam. And I'll go ahead and click here, labor onset date and time. I'm going to say, let's say this patient started labor 10, and then sign that. And then if you go back to the acute workflow and refresh the page, it will launch the partogram. And so it's bringing in all the information here. You can see it brings in a lot of the clinical information, gestational age and gravity and parity, labor onset, previous C-section, the time since ruptured membranes. Oxytocin is here and will also show on your graph. It'll be in pink on your graph. This is the epidural, and the epidural is on blue on your graph. And then these things will show up on the graph if the epidural is bolus, if the pitocin is increased, and it'll also show the milliunits of oxytocin here. And you see these are the alert lines for when labor falls out of the general standards, and you can adjust this graph to look at different time periods to focus in or out depending on what's appropriate for your patient. Other things you can see on here on the same graph, you can see the fetal heart rate. You can watch the baseline and see if it's going up or decreasing, and maternal vital signs. And so you can look at these in relationship to where the patient is in labor. If you chart the position of the fetal head, if you can feel the actual position, it'll give you this little picture that'll show the position of the fetal head. And so this is a useful tool for following your labor patients, and it brings in the clinical information that you need during that time. So if you're on labor and delivery and you're managing patients in labor, what you may want to do is move the partogram to the first position so that then when you navigate to the acute workflow and open a chart, it will open to the partogram. So this was a demonstration of the partogram, and hope it helps you manage your labor patients.